Hello and welcome to IRL Jax, where I am Jax and this is my real life. Today we're continuing our Skill Up series where I make videos that help you skill up and learn about what you need to know before you hit the doctor's office so you can have an informed and two-way discussion between your doctor without feeling overwhelmed or not in the know. Today specifically, we're going to be talking about Clomid and Fermara through the lens of both the chemical side, the emotional side of the side effects, and what it means specifically to those of you ladies suffering with PCOS. If you like this video, please give it a thumbs up, and if you want to follow along on this series or for my own personal journey with infertility, go ahead and click that subscribe button. All right, let's get started. Today, instead of me being a talking head, talking at you for the next 10 minutes, I thought that I would do something a little more fun and draw out the concepts that we're going to be talking about today. So we're going to be talking about Clomid, also known as clomiphene, and Femara, also known as letrozole. Both of these work to try to fix ovulation dysfunction. 40% of infertility is caused by ovulation dysfunction, which is what these drugs try to address. Both of these drugs affect the cycle of communication between the brain and the ovaries, which you will see me trying to draw. Please forgive me. My artist friend was out of town, but I wanted to get these videos recorded. How this cycle normally works is the brain sends out FSH, follicle stimulating hormone, also known as LH, luteinizing hormone, to the ovaries. The ovaries then produce estrogen, and that estrogen feeds back to the brain receptors to confirm with the brain that estrogen has been made successfully. Clomid works by blocking these estrogen receptors in the brain. So when the brain checks in with these receptors to see if estrogen has been produced, it doesn't get any sort of reading, and so it produces more FSH in an attempt to stimulate the ovaries to make more estrogen. This is helpful in women who don't ovulate on their own, because then the ovaries are stimulated more than they normally would and hopefully reach a normal level and actually produce a follicle and ovulate it. It's important to note that Clomid works on the brain side of this equation rather than on the ovary or uterus side. Another side effect of this methodology is that your level of estrogen can be higher because obviously your brain is producing more and more since it thinks you don't have any. This high level of estrogen can affect your uterine lining as well as your cervical mucus, leading some women to believe that Clomid actually causes an insufficient lining for implantation. Another worrisome factor of Clomid is that it lingers in your body for several weeks, which means it's in your body when your embryo is trying to implant. Alright, so I'm drawing this box because there's a few things that are similar between both Clomid and Femara, and I want to have a place to kind of keep track of those as we go along. First of all, they're both 5 tablets. Depending on your doctor's preference, you're going to take them on different days of your cycle. Both of them are 5 days of consecutive tablets, somewhere in the beginning of your cycle, either days 3 through 8 or 4 through 9 usually. So the upside is that 80% of women will successfully ovulate on Clomid. The downside is that there's a very high twinning rate with Clomid. 7 to 8% of women will end up getting pregnant with twins, which automatically makes it a high-risk pregnancy, so definitely something to consider. Also, with both medications, there's a very similar list of side effects that are quite numerous. They include uterine bleeding, breast tenderness and discomfort, headache, nausea, vomit, diarrhea, flushing, blurred vision, ovarian enlargement. And of course, with both, there is a very small risk of OHSS, which is ovarian hyperstimulation syndrome, which is very, very serious, and you do have to go see a doctor. Usually, you end up in the emergency room if you have OHSS. So, something to keep in mind. Let's go ahead and switch over and talk about Femara now. So, unlike Clomid, Femara actually works on the biological processes happening in the uterus and the ovaries. Normally, this system is responsible for transforming androgens and testosterone into estrogen. So, sorry, I had to dig a little deeper into the biology of that. So, that's actually how your ovaries produce estrogen. They transform those other hormones into estrogen. What Femara does is it stops that transformation from happening. So then, when the brain looks for estrogen, it can't find any because there isn't any, and it sends out a signal the LH, FSH signal to the ovaries to produce more estrogen. Now, for some reason, this methodology actually, women on Femara tend to have less follicles develop than people on Clomid, and you'll see that translates into a much lower twinning rate. But the other side effect of this is that it does not affect your cervical mucus or uterine lining. Another upside is that it leaves your body within a few days. So by the time that an embryo is ready to implant in your lining that's usually thicker now, it won't have any of this drug interfering with that. The twinning rate is also less than 1%, which is just leaps and bounds better than Clomid. And we finally get to the part that I know a lot of you PCOS warriors out there are interested in. And in a study in the New England Journal of Medicine comparing birth rates of patients with those who use letrozole instead of Clomid, they were able to achieve a significant higher rate of live births. Women who were on Femara had a 27.5% live birth rate, while women on Clomid had a 19.1. So you definitely can get success both ways, but it seems that Femara is significantly better. It's important to note that that 80% ovulation rate that I cited for Clomid is for people that do not have PCOS. With PCOS, that number drops around 50%, while the ovulation rate with Femara is around 62%. Neither of these, going back to things that are similar between them, neither of these drugs have any known increase in birth defects. Both of them are going to require the same amount of monitoring. You should be monitored while you're on these drugs to make sure that you are ovulating. If you are a low-risk candidate, a non-PCOS patient, you might be allowed to do this at home with strip tests. And if you are higher risk or you're going to see a reproductive endocrinologist already, then you are probably going to be monitored with ultrasounds. One last thing that I forgot to mention that you might want to look into is that Clomid is being used on-label while Femara is being used off-label. All this means is that the drug company did not originally intend Femara to be used to induce ovulation, although it is now considered very safe and common practice to do so. Just have that in the back of your mind when you're talking to your doctor. They might say that it is the off-label use. It's not dangerous. There's clearly studies about the effects of Femara on ovulation, but the drug company has never come out and said that they approve it for that use. I hope that you found that helpful. If you have any other questions or you need other clarifications, go ahead and leave them in the comments below. I hope you find this helpful and you find that you can have I hope you find that you can have a better conversation with your doctor with this knowledge. And go ahead and hit subscribe if you want to follow along on my journey, or you just want to see the next episode of this Skill Up series. I really just want to make sure each and every one of you is as informed as you possibly can be so you can be a great self-advocate. If there's a topic you want me to cover, go ahead and leave it in the comments below. Alright, that's all I have for you for this lesson. I hope you found it helpful. If you found out something new that you didn't know before, make sure to give this a like. And if you haven't followed along with my story and you care to, go ahead and hit that subscribe button. And until next time, ladies, keep on fighting.